Millie, I'd like to say a huge welcome to you this morning. I'm delighted that you have joined the Society and that you have become our patron, actually. You're our first external patron, I'm going to say, because I took that role when we first started the Society. And we're particularly keen to have somebody from the outside world, so to speak, and who better to start us off on that role. Yeah. So what I would like to do is ask you a little bit about some of the work you've done that involves dental nurses. And I know that you're keen to share all of the things you've done, and we might not even have time because you've done so much and you've got so much experience with us. But maybe if I could first ask you, I know you were a very early adapter, informer, developer, all those wonderful words that sit with Mouthcare Matters, but I know you were involved with that. And then perhaps we can move on to other things.
Okay, so well, thank you so much for inviting me to be the patron. I'm delighted to be involved in this role. Mouthcare Matters, when we started, and we have to remember, it started with myself and a dental nurse, my dental nurse Jenny, who was our oral health promoter in the hospital. And dental nurses have been a pivotal role in, sometimes people think, oh, they're the ones that delivered the training, but it's been much more than that. They've been really important in developing it from the start. So all those early ideas, because when we started Mouthcare Matters, we had a blank canvas, and it was just this idea of trying to improve oral health on hospital wards, and we're very keen on not it being a classroom-based training and the importance of going out on the wards and really taking dental nurses and our team out of our normal environment of the dental surgery and working on very different wards with different people, with lots going on, and trying to raise the importance of oral health. And with Jenny, it was great, and we worked and we went and observed lots of nurses, speech and language therapists, doctors, and took our dental hats off and looked very, holistically as oral health as part of general care. And after that, we had a small team at East Surrey Hospital who were dental nurses and a hygienist. And it was a great team. We used to, bounce ideas off each other, look at things that worked. One of our dental nurses was also a design developer. And some of the work that we still use today is everything that she designed in those early days. And I really want to mention Katie, because unfortunately Katie died a couple of years ago, but she was such a pivotal role in this program. So Katie Blake, it's nice to sometimes see all her work and her posters around there. And our team grew, and it was a great environment, not only just in training, but in working in developing audits, developing all the resources, the videos. We all did that together, and dental nurses have been a fantastic role. When we looked at Mouthcare Matters across Kent, Surrey and Sussex, this was really exciting because we managed to get funding to have somebody lead the programme in each hospital. And about 8 out of the 12 people that we employed in each trust was a dental nurse. And a lot of these dental nurses came from a hospital background. And I remember when we were doing all the training together, because we used to have study days, and everyone was a little bit anxious because it was completely a different role, but it was so exciting to develop it from scratch. And the nurses were involved in not only delivering training, but this real leadership role. So things that may not have done in the past. So working within obviously our competencies and not within us, and working within our scope of duty, but things like presenting to their boards about the importance of oral health. Now, I know how nervous I get still presenting, but some of these dental nurses hadn't done this before, like doing PowerPoints, putting them together, collecting data, doing audits, speaking to people. Because sometimes, it wasn't always welcome, because sometimes people thought, well, maybe, are we criticising care? But going in there, using those personal skills, showing people that we're not there to say Mouthcare is not good enough. Well, sort of, it wasn't there to criticise people, but as much more of a supportive role. And it was one of the things that I'm most proud of is how much our nurses developed their skills, and they became so confident and passionate and advocates, not only in delivering training, but developing resources. We have a WhatsApp group. If they had an idea, we'd share ideas into innovation. And they were working within different teams in hospitals, having to really get quite a thick skin, because you might get criticism. Some people might be quite negative about the program, but also sharing some wonderful patient stories and really making a real difference to care. And not only within Kent, Surrey and Sussex, we've seen lots of dental nurses take on this leadership and management role, because in terms of Mouthcare Matters, and it's just been a different role that has developed. And we've just seen so much good work come out of this. And it's great when we get the chance to share our ideas and to see that passion and see what people have delivered. And some of our mouthcare leads were non-dental nurses, they were speech and language therapists and nurses, but actually working in as a team and being able to share those ideas, transferring some of their skills and really learning from each other. And we still have lots of Mouthcare Matters people in post. So if I talk about my own trust, we have Lorraine, who is our Mouthcare Matters lead, has been with us since the development of the programme, and we've just developed a really nice role where she's she is in charge of all the training for all the staff, all the new staff, because people move on so quickly. She does audits. If there's a problem on the ward, she'll be the first person down there to give some advice. It's very important that she works within her scope of duty, but if there is somebody that needs an urgent dental problem, if anyone has an urgent dental problem, she's able to liaise with the team and ensure that person gets care. And I'd love, and a lot of other mouthcare lead people are in roles across Kent, Surrey and Sussex, and it's fantastic to see and continuing to develop, because I always remember Stephen Lambert Humble was the person that had this idea, and it was his idea, Mouthcare Matters. And he always used to say to me, Mouthcare Matters is not a project, because a project has an end date. It's an initiative, because it always has to keep going. And to have this role recognised and funded now by the trust, so it's an ongoing role, is a fantastic thing. And what we've now seen also is because of all these skills that the mouthcare leads have got, when we've gone through COVID and both pandemics, we've seen them, these nurses and also other dental nurses in hospitals and in the community, and be redeployed and do some fantastic work. And I know Lorraine, for example, spent 12 weeks on ITU, and she used her skills to do mouth care on there, and also learn lots of other skills which she shared with us. And some of our nurses have been involved in fit testing, everybody in the hospital. Some have been involved in occupational health, working on A&E, and just being so versatile and really, changing their hours, doing night shifts and everything, and learning so much. And it's been fantastic to see, and delighted to see so many nurses now hearing more about them vaccinating, which is such an important part. And I think COVID has had lots of negative things, but one of the positives is really highlighting me the role of the dental nurse in being able to do so much more in hospitals and in the community.
I think you've touched on so many really important points there, Mili, and you know that the society themselves are particularly keen on education. That's our whole focus, and how we grow people, and how we create opportunities in education, and how we challenge education and learning to create opportunity. And I know you mentioned in an earlier discussion that for those nurses who don't want to do additional things, if that's okay as well, you still have a part to play. And one of the interesting things is how we then grow dental nurses, or allow dental nurses the opportunity from general practice to look at this type of work as well. And it's been really interesting to see in this situation in the pandemic, to see some of the dental nurses, there was a lot offered actually to actually go to frontline, and how they adapt. Do you think that when this rolled out, that dental nurses adapted well, or are there things missing from curriculum that perhaps could be added?
I mean, I think that what we have shown is that dental nurses have adapted well and have been so keen to do other things. And I really hope that post-pandemic, when we look back, we really do focus on that, about everything that people, delivered and everything that people did. But I do think there are gaps in the curriculum, and there are lots of courses out there, such as the oral health promotion course, and could we adapt that a little bit for more of these versatile roles? So it's a lot of that has been traditionally delivering, focusing on the dental health and the fluoride and the sugar and everything, but I think there's much more now. We know the links between oral health and general health, and I think there's much more scope to increase the scope of what dental nurses can do. We know the links between diabetes, having dental nurses. Can we look at them maybe being on diabetic clinics, delivering some of that care, working with a team? We know the links between aspiration pneumonia. Could we do more practical work in going into respiratory clinics? I think what I would love is, the mouth care. What sometimes worries me is that when we developed a really nice training package for mouth care lead nurses, I'd love to be able to share some of what we did in terms of that training, or use the nurses that are in these posts to actually widen the curriculum. Because wouldn't it be great if we could have a training package and it could be part of a curriculum? And we're going to need it so much more now. We've known for a long time the changes in oral health, especially of older people, but also anybody that is maybe vulnerable. And, we've seen that COVID has impacted on people in care homes quite very severely. And, there's that role of taking some of what we did with Mouth Care Matters and taking that into the community, because we all know that I could sit here and deliver a presentation on how to brush teeth, but there is nothing better than if there's somebody on the ward or in a care home, and maybe they've got a swallowing issue, and showing a carer, this is really important on, with a light, looking in the mouth and cleaning the top of the roof of the mouth. And this is how you can do it. Can I show you how to take this denture out? Because it's such a hands-on skill. And I think for a long time, mouth care or health has always been something, it's quite easy. And I know that recently we've been working on the wards more, and it's a two-person job, because you need a light, you need some suction, especially for these, and actually just, showing people that actually it's challenging. It is not just a case of simply brushing somebody's teeth. And I think dental nurses are so passionate, and so many of them really, have those really good personal skills with that you need when you're working with people at risk. I know when you go on to, or you might speak to an older person at the moment, and they're quite lonely, they're not getting the same amount of visitors. And it's not just a case of going in and saying, I'm here to do your mouth care. It's spend 10 minutes having a chat with them. It makes such a difference. So I think there is a lot that we can add to the curriculum, the scope. And I really hope that because of COVID, we've demonstrated the roles of dental nurses, and actually the versatile roles. And yes, like we've said, that it's really, working in the dental surgery is really important. That's great. But for those who might want to do some other things and think holistically, we've seen that throughout the profession, and there's been a big push on dentists doing non-dental things and working outside of dentistry, that we could do the same for dental nurses.
Yeah, so it's bridging that gap, isn't it, and interprofessional learning. And I have to say, one of the things I find really interesting, because, the makeup of the committee and the councils here, but we have particularly 2 or 3 people who've actually been redeployed onto the wards. And what they have found is how easily they've fitted in, and how easily the other professional groups have accepted them. And sometimes we all know that when you get newness coming together, it doesn't always work. But, in times like this, it really, really has. It really has. And I think there's a better understanding of each other's roles, or maybe we're sort of very protective of our own roles. I don't know whether that's a barrier or not. And maybe we need to look at what works well and what's a barrier. Did you come across any sort of barriers as you tried to put this into your trust, or was it fairly easy?
There were barriers. One of the biggest things is scope of duty. And there was lots of things about, well, can a dental nurse go onto the ward and brush somebody's teeth, or, can they do it? And we had to really look and speak to GDC, because we're not practicing the art of dentistry. They're not going down with scalers and picking calculus of people's teeth. A dental nurse going down and looking at, if somebody's got a lot of plaque, or somebody with learning disabilities on the ward, and the nurses have never seen maybe a 3-headed toothbrush, or how to maybe brush the plaque off, or not recognizing it is what we saw. So the dental nurse can go down and show somebody, demonstrate with, and something that we've seen is how good their cross-infection is. They were doing it before. They were wearing visors, gloves and things when people were not even doing that, and showing nurses how to do it, how to take a denture if they've been trained and competent. And that was one of the biggest barriers within the dental profession about, is this a legal role? But dental, one part of our training was really talking about that scope of duty, and saying, and we did a big program. If somebody came in and said, oh, what's that? Has that on their tongue? Mouth Care Matters' lead role wasn't to say, oh, that's thrush and you have to diagnose that. But it was to say, actually, this person, it's more about you need to then refer this person to the medical team and they're going to diagnose. But yes, the mouth care role is all about working with the scope of duty, the oral health, and if something is not in their scope of duty, referring on appropriately. So that was one of the barriers within dentistry. And, we had to be really sensible. And I used to try and always say, you've got a healthcare assistant who's done no training in mouth care, and they're going down to the wards and expected to do all this. Whereas we've got these highly trained dental nurses, and if we've done the training, we've shown the competence, they should be able to go down and demonstrate hands-on training, especially for those more complex patients, especially for those ones that, we see now, with swallow issues and lots of secretions in the mouth, things that we don't traditionally see in the dental clinic. So that was one of the barriers within dentistry. Outside, there's always going to be some people who who don't appreciate this, and sometimes they were, and that's where that thick skin came. So people making those odd comments like, oh, I don't know what these people are doing, they don't know how busy we are, and that's why that sort of communication and that importance. And something we did was we gathered data, and that's what our leads did, and we shared this on our website. So for instance, patient stories were very important. But if the dental nurse could go on and register an audit and basically audit mouth care recording, audit how many patients had mouth care products, audit how many had, when we talked to patients, how many had actually been asked if they'd had mouth care that day, and then be able to present that. So you've got those accurate figures. So if you could say, well, actually, I've got no policy, none of the nurses have ever had any mouth care training, we're recording it in 10% of cases, I've spoken to 10 people on the ward and they've said they've not been asked if they've got their mouth care products, and going in with that evidence. And then some of our patient stories, I know whenever I talk about Mouth Care Matters, I'll always start with a story to show how the failure to look in somebody's mouth or the failure to deliver mouth care has meant that person has suffered in quite a significant way, because that sometimes means people appreciate the importance. So there were barriers, but a lot of and it was hard, and I'm sure there have been tears and frustrations, and there still are, but there's also been a lot of success, a lot of people really starting to appreciate. And, like when the nurses are going onto the wards now, and I can see it on social media, you see pictures of not dental nurses posting it, but, matrons and heads of directors saying, we're so happy, for instance, the dental nurses are on our ward, or the dental team are helping us with mouth care. And it's really nice to see this a few years on, because they're appreciating the importance of it and are really, as you said before, really welcoming of having this support, and it's raising awareness.
I think that's really good, and I think we want to come out of COVID looking at opportunities. As you say, we can't ignore the sadness and the challenges that we've been through, but we do need to look at opportunities, because so much good has come from this. And you can look back already, and I know we're not there yet, but we have done things differently. We have talked differently, we've acted differently, we've jumped some of and not in an incorrect way, but we've moved some of the barriers into being able to work in different environments with different people. And I know that there's been a lot of talk about you removing bureaucracy and red tape. And like you, very early on, in my role as chair of the National Oral Health Promotion Group, I approached the General Dental Council about what is the capacity and the boundaries of an oral health educator. And I know that role's slightly different, as we've mentioned. And the upshot is that that's not an act of dentistry. And, I know that needs teasing out a bit. There are boundaries that we have to apply to, but then, we need to look at those and what is the breadth of that scope. And I think that might give us something very different as we move forward. I'm quite excited for the future, actually. So I think on that note, Mili, I think you've given quite a lot of background about the programme, about the things you've done. Is there anything that you initially think we could explore? And it's not to put you on the spot, but explore around the role of the dental nurse looking differently.
Yes, I think there's just I think we need to sort of almost like map it and look at what people are doing now, and look at all the additional things that have worked during COVID and recently, and what other things that we can do. So obviously, I look from an oral health kind of perspective on in care homes and people in their own homes and extending their roles. But there's so much we can do. I mean, we had our gerodontology meeting recently, and it was really interesting hearing about some of the roles of improving, because we know domiciliary care is a big problem. But having this link role, and there was a great presentation by somebody talking about these dental nurses having these link roles and really teasing out those patients that needed to be seen urgently and things. And there's so many things like that, little projects that we could get involved in, and I think would be really good for dental nurses to be involved and look at where the training needs, where there are gaps, and seeing can we work together to fill in those gaps, because like you say, this is a really good opportunity. So I think there's lots of different roles, and thinking really holistically about oral health and general health, which has been very topical, the whole thing about putting the mouth back into the body, which some people love that term, some people don't love it so much, but actually taking it seriously, actually the dental nurse's role could look very differently, and it might not be like it's a full-time role. It wouldn't be great if, because it's really important we keep up our skills, and it could be like one day a week, a dental nurse maybe doing a different role out of their normal day-to-day work, which could be really beneficial. And obviously that will take funding, and that will take work, and how does it work and things, but there's some really good opportunities now, and I think it's some good pilot programs, and really to look at reflecting on some of those things. Like I said, I'd be very keen. The Mouthcare Matters programme has ended, but at some point those Mouthcare Matters leads will maybe one day decide to do something else, and hospitals will be looking to recruit people to have this lead role, like you have a tissue viability nurse, you have an infection control nurse. My dream was every hospital had a mouthcare lead nurse, or every trust. But who's going to provide that training? It could be us, couldn't it? We could do that, and we could develop it from our learnings and all the different stakeholders. I think that would be something that would be really positive. And like we say, COVID has given us a lot of sadness, but there may be some opportunity at the end of this, and to build on that, and because that's something that we have to look forward to.
Maybe that's your mission as our patron.
Excited to, and I know not me, but there's so many people out there, and a couple of years ago we held a day where we had all people from all over the country that have been involved in Mouthcare Matters, from healthcare assistants to speech and language therapists to dental nurses. I don't think I've ever seen it sat in a room with so much energy and drive and ambition, and people working so hard in their own time to do all this thing. And I just think that we all get a little bit sidetracked with our day jobs and everything else, but this is really important, and it would be something I'd be delighted to do and work on. And just again, raising the profile of dental nurses. I talked to my dental nurse this morning about things like, for instance, a part of the gerodontology committee, I'm always really proud that we have spaces for dental nurses, because I really like these, a committee shouldn't just be a committee for dentists, it's a team. And we'll really push that, and we will continue to do that. We'll always have places for nurses. Some of our best posters come from our dental nurses, and having, encouraging them to do things like do some of the essays on, for all these different societies and things. It's really important, that support. And, I've met nurses that have gone on to do like research, and NIHR funded research. And it's been really interesting to just see that, traditionally, in the past, sometimes at all, dental nurses' role was, people would think it's quite limited, but it doesn't have to be, and that's something we really want to raise awareness of. And it'd be really good to promote some of these other things that people can do, if that's what they choose to do. It might not be for everyone, but I think from the work we've done, and I think from a lot of the experiences of dental nurses during their redeployment, seeing a different side to things, it's a really exciting opportunity.
Yeah, no, I think it's wonderful. You mentioned NIHR and things. I mean, it would be lovely. One of the other things that we do struggle with is being given the space and the platform to write papers and have them published. So dental nurses don't get that opportunity. There are papers published by a few dental nurses, but this is about real activity, not always about theoretical stuff. So I think that's maybe part of the
And presenting. One of the things, when I was president for gerodontology, I was really keen on having dental nurses present at my meetings. And I remember in my spring conference, a couple of the mouthcare matters lead nurses presented. And I was so proud because when we got, they were the best. And when they got the evaluation, they were, compared to some of the very, polished speakers that have been presented for years, you've got these good names, but their evaluation, because it was so heartfelt, and they presented, and it was, they got the best feedback. Again, when Lorraine, in our last virtual gerodontology program, she talked about her experiences of ITU, and it was, the whole meeting, and I spoke to a lot of people, that's what they remember, that talk, none of the others, because
it's real.
But there was just, and I think, nurses speaking and presenting is really important as well. And, I always hate presenting, but, so nurses are great. They've got, they've done so much, and really hearing their voices. So, when you see, I love to see, when I see an event, it's not just like, Professor so-and-so and this, and it's great to see some of our dental nurses presenting and being on that platform. And I really want to encourage more of that.
Yeah, no, that's okay. So you've now got your 3 top points, your 3 things to take forward. And we haven't even got to planning stage. I think you just started the ball rolling. Mili, I'm going to say a huge thank you to you for doing this interview, and obviously stop the recording, and I'll catch up with you in a second. So thank you very much for that, and brilliant interview.